Surging COVID-19 infections are worrying governments around the globe. Here in Europe, France has recorded a record number of infections, 200,000 in a single day. Italy, Ireland, and Portugal have also announced record numbers of new cases. Officials say the skyrocketing infection rates are being driven by the highly contagious Omicron variant.
A new national record for France. Here, every second, more than 2 people are testing positive for the coronavirus. Police patrols have stepped up in response. They visit bars and restaurants checking people's vaccination passes. And for the still unvaccinated, French authorities have a grim message.
There is really very little chance you can escape it this time. The virus is spreading too fast, and unvaccinated people are more likely to get infected or very sick.
Germany, too, is putting more pressure on the unvaccinated, leading to several protests across the country. In Munich, police initially banned a rally, but protesters came out anyway by the thousands, saying they're just out for a walk. There is also concern that Germany is underreporting cases due to staff shortages during the holiday season.
The underreporting is probably of the order that the actual incidence is currently 2 or 3 times as high as the incidence we are measuring.
The UK is facing a surge in Omicron cases, and there is frustration that rapid test kits aren't available.
I went to pick some up and there's none in the pharmacies around my way. There's none, they've all got the signs up saying they've run out, so...
Many people need a negative test to be allowed to work or gather to celebrate the start of a new year.
For more now, I'm joined by Christian Lindmeier, spokesperson for the World Health Organization in Geneva. Mr. Lindmeier, thanks for being with us. Your organization's Director General says the Delta and Omicron variants of the coronavirus are creating a tsunami of infections. What's the worst-case scenario you're trying to avoid?
Well, thanks for having me. What we're having right now is a still existing Delta variant, which seems to have higher severity in the cases, and at the same time, an extremely quickly spreading Omicron. It's the vast majority of cases. Many countries around Europe have been reporting record cases never seen in 2 years, and that combination is certainly something which could easily strain and overburden the health system as we have it. And though maybe severity might be lower in Omicron, the sheer numbers game leads to the fact that the hospitals, the clinics, the healthcare workers, the system is completely overloaded. Public transports, public installations, offices have to close because workers being not able to go to work because of the high infections rates. So this is really a worst case scenario, and we have to do really everything to avoid this.
Omicron, it's on everyone's mind right now. Reports from some countries, South Africa, for example, suggest that with that variant, infections are less severe. Can you confirm that? And what should we expect from Omicron in general?
It's still too early to really firmly confirm. The indications we have so far and the early reports and early studies out of different countries indicate that yes, indeed, Omicron could be less severe. But many of these studies have been done in younger populations, in student populations, which in any case should produce lower severity of cases. So we have to be careful there. And what we also don't know, and that's important to remember here, we don't know anything about the long-term effects of Omicron yet. So we have to be careful with this seemingly less severe Omicron.
What are the crucial measures that need to be taken now to stop this pandemic from getting worse?
What we have seen in the last 2 years, that the comprehensive package of all the measures that we have really works well. That starts with your own personal protection, with using the proper hand hygiene, the mouth hygiene, using the mask whenever possible or necessary outside or in closed rooms. Avoid assemblies of people, avoid crowded rooms. It's also in Northern Europe now, or in Europe, in the Northern Hemisphere, ventilate your rooms as often as possible. All these are traditional simple measures that we all can adhere to. And on top of it, the vaccines do give protection. They give protection certainly against the Delta variant, and they also give protection against the Omicron. So if you're offered a vaccine, please take it. And if you're offered a booster, it's also time to get it.
Mr. Lindmeier, thank you very much for talking with us. That was Christian Lindmeier, spokesperson for the World Health Organization in Geneva.
Thank you.
Wolfgang Preiser is a virologist at Stellenbosch University in Cape Town. Thanks for joining us here on DW. I want to start by repeating we're seeing record infection numbers here in Europe and in other parts of the world. How worried are you about all these new cases?
Well, it actually shows very much what we had seen here in Cape Town, where and in South Africa, where Omicron first spread throughout the country. We had a very steep increase to record numbers of infections, and we were extremely worried that over the festive period, because it started in late November here, we would then have record numbers of severe cases being admitted to hospital. And very fortunately, our infection numbers have peaked. So we are now on a clear downward trend, and one has to be a bit careful because of the long holiday weekend. So numbers may be lagging behind, but I don't think the picture is going to change drastically. And luckily, our hospitalization rate has been lagging behind significantly. So we see far fewer severe cases needing hospital treatment than in the previous waves. And of course, the reason here in South Africa is that the majority of people have had COVID during the pandemic over the past almost 2 years. And in addition, we have just short of half the adult population having had the vaccine as well.
So put this in perspective for us. There's been a lot of talk about Omicron being not much more harmful than the common cold. What are virologists learning in South Africa about Omicron and its potential threat there?
We are looking at data as they emerge, and one really has to say it's all very early days. So, and we know that there is a time lag between becoming infected and developing severe disease. But we are cautiously optimistic. However, we think that the main feature in Omicron is the large percentage of the population that has some degree of immunity against it from past infection or vaccination. And I think that's something that's different in many European countries, where those who have not been vaccinated remain largely unprotected. By protection, I don't mean protected from infection. We know that Omicron is very good at causing breakthrough and reinfections. So having had it or having been vaccinated will not protect from becoming infected and also from becoming infectious, but it will protect from becoming severely ill. And that is what we are seeing in our hospitals. We are getting patients, of course, with severe disease due to Omicron, but those are the people who have not been vaccinated.
A lot of people are wondering whether there could be a silver lining here. That is, the rapid and widespread of Omicron will bring us closer to turning COVID into a more manageable threat. But it sounds like you're saying that the reason why Omicron is not manifesting as dangerously as other variants is because, to a large extent, people, particularly in South Africa, may have had the virus already and therefore have antibodies.
It's very difficult to tease those two factors apart. Again, I'm cautiously optimistic that maybe Omicron is a bit less virulent than the previous strains, but we are still seeing patients dying from it. So, it's not a question of a common cold virus yet. It may be moving into that direction, and that would be good news. But the bad news is that, and I like what was said in France in your report, that with this variant, it will be next to impossible to escape infection. We have seen how fast it spreads and how fast the numbers rise. Many patients are also, many infected people are asymptomatic, so not necessarily recognized, but can still pass it on. So I would say that over the next few months, the majority of the population will get it.
We'll have to keep it there. We'll have to keep it there. Wolfgang Preiser, really appreciate your time in Cape Town. Many thanks. Let's take a look at some other developments in the pandemic. South African researchers have found a booster shot of Johnson & Johnson's COVID-19 vaccine is 84% effective at preventing hospitalization. COVID-19 cases have reached a record high in the United States. However, the country's Centers for Disease Control and Prevention says deaths and hospitalizations are comparatively low. The Ice Hockey Junior World Championships in Canada have been canceled. That's due to a number of players testing positive and entire teams being ordered to isolate. While countries are still grappling with rising case numbers, health authorities are also under pressure to reduce the isolation requirements for people infected or in contact with a positive case. The U.S. recently shortened its quarantine period, and Germany's health minister says he's considering a similar move. DW reporter Joel Dulroy joins us in the studio to explain what's behind the race to reduce quarantine.
Until recently, health authorities around the world have mostly followed the scientific recommendation that people isolate for up to 2 weeks after testing positive or coming into close contact with an infected person. But now, as the Omicron variant kicks off new waves of infections around the world, more people are finding themselves stuck at home. Tracking data shows over 19 million people have tested positive to COVID-19 in the past 28 days. And that has had an impact on the economy. Some hospitals, schools and businesses are finding themselves short-staffed. Recently, thousands of flights were cancelled. US airlines demanded a shorter isolation period to get people back to work. And this week, the US Centers for Disease Control cut the recommended isolation period down from the previous 10 days to 5 days for people without symptoms. Spain, the UK and others are also reducing isolation. And other countries may follow, including Germany, France and Italy. But how risky is this strategy? The CDC's own modelling found that after 5 days of quarantine, there was still a 35% chance that a person could pass on the virus. Now, that risk reduces to 1% after 10 days. So why shorten the isolation period? Well, previous variants have had an average incubation time of around 5 days. However, some studies are showing that Omicron has a faster incubation period of around 3 days. Infected people may develop symptoms more quickly, and some are arguing that that could allow quarantine to begin and end earlier. But other scientists are urging caution, warning that there is still much we do not know about the impact of Omicron. The decision to reduce isolation periods may be welcome news to millions of people stuck at home, but it's a calculated risk that is being made to get people back to work.